Okay. Start with Dr. Fernandez.
Yeah, great evening and great pleasure to be here. I'm Luis Fernandez. I went to medical school at the Universidad Central de Venezuela and came to United States to complete my graduate training. Went to University of Miami where I did no 5 by 7 years. Regularly, every general surgeon do 5 years of training, but I did two additional trainings in um, doing research in islet cell transplantation, and that where my passion for transplantation started. Then went to University of Wisconsin, in which I did 3 years of training, one in research, 2 more years in clinical. Stayed there as a faculty for 21 years, and migrated just the last year to uh, Loyola Medical Center in Chicago, where I'm the division chief and professor of surgery. I'm delighted to be here and thank you for the opportunity.
Dr. King.
Hi, everyone. Thank you so much for having me. I'm Betsy King. I am an assistant professor of surgery at Johns Hopkins. And I am originally from Chicago, where I did medical school at the University of Chicago. And I came to Maryland to do residency at Hopkins. And I completed my general surgery training at Hopkins, and then also did 3 additional years of research training at our School of Public Health here to get a PhD in clinical research. And I then did my transplant fellowship here at Hopkins as well. And I was lucky enough to stay on faculty, and I am a sort of young faculty. I'm just in my second year as an attending surgeon. And I act as our fellowship director, and am pretty passionate about educating our fellows, and also have an growing interest in pediatric transplant.
Dr. Anderson.
Good evening. My name is Doug Anderson. I'm an assistant professor of surgery at the University of Alabama at Birmingham, doing kidney and pancreas transplant. I grew up just south of Nashville and stayed close to home, did college and medical school at Vanderbilt. Then did my general surgery residency, a couple of years of research, and my transplant fellowship at Emory in Atlanta before completing the Southeastern Circuit by moving here to Birmingham. And I've been here for just over 3 years now, and like Dr. King, serve as our fellowship program director.
Right. Dr. Syed.
Hi, my name's Sharif Syed. I was born and raised in England and did my medical school at the University of Leicester. And then I worked in the NHS for a few years before moving to America. And when I first moved here, I moved to a small place in northern Michigan called Saginaw. But was able to transfer to UCSF for my final years of surgical training, and then stayed and did my fellowship here. And I trained at the same time as Dr. Anderson, so I'm about 3 years out, and my practice includes liver, kidney, and pancreas transplant, and then hepatobiliary surgery, so removing tumors from the liver as well. So I'm really excited to speak to you all today about my experiences and how great transplant surgery is.
All right, great. Well, in listening to you all introduce yourselves, you all have an immense amount of training and expertise and accolades. What is a typical way to become a transplant surgeon coming out of medical school? What's the typical path people take?
So I can take that one. So transplant fellowship is a post-residency fellowship. And so to become a transplant surgeon, you first have to do a residency either in general surgery or urology. So you can do both, or I should say you can do either. I'd say most folks applying to transplant fellowships today have taken the general surgery route. And then transplant fellowship is an additional 2 years after your residency, and then you can go from there.
All right. Anybody else want to add to that?
I would say that to complete that, the typical application happens um, at your third year level, in which you start to collect your letters as a 4-year resident, and you go and you do interviews. Typically, the process of interviewing new candidates go from November to sort of March. With COVID extended a little bit longer to April, May, and then June is the final match. So he's going through a national ranking matching program, the same way that students go to medical school or residents apply for residency. One of the things that I think is vital to be competitive as a potential transplant candidate is in the initial couple of years to focus on how to enhance your CV, so to speak, whether you decide to take a couple of dedicated years to research in a well-funded laboratory will be a plus. In a place that you have an opportunity to expose yourself to translational basic science research or clinical research, it doesn't really matter. What probably matters the most is perhaps to have exposure in addition to your clinical training to some experience during research, and then get connected with your mentors. Hopefully you have done well during your rotation in transplant, and you have captured their attention, and you get some good letters of recommendation. For those that do not have that opportunity, probably the best thing will be to reach out to other transplant programs that can offer an externship, so they can actually engage in transplantation and really understand if they fit and this is what they like of a lifestyle, because certainly you're buying a lifestyle that is very unique in comparison to other specialties.
I would just add to what the others have said that, as from a student perspective, transplant surgery is really training that builds on the training you get from, either a general surgery residency for the most part or from urology. And in many ways, you can really be involved and growing as a general surgical resident and be exploring transplant and exploring some of these, things that are coming up in the question and answer and that Dr. Fernandez brings up of, what the lifestyle is like and, what a typical day as a transplant surgeon looks like while you're getting training as a general surgeon. And so that in many ways is nice because you are developing yourself as a general surgeon while having the ability to, explore it among other choices of post-residency, special subspecialty training. And so from a medical student perspective, transplant isn't a decision that you have to make, right now. It's a decision that you can make after you've been exposed to other types of surgery and have had the opportunity to, really get your feet wet and see what different surgical fields are like. And it isn't a decision that you necessarily have to make as a medical student.
And then, I'll add to that is, the main thing that I would suggest is to get some exposure, because the one thing that is unanimous across all transplant surgeons is our excitement and enjoyment in terms of the procedures that we perform and the transformative surgery that it is. And so any opportunity that you can, even as a medical student or as a resident, being on the transplant service, we all have stories of, connecting our first kidney to the patient and watching, urine come from the ureter and curing the disease, in a 3-hour operation, and saving them from going to dialysis, 3 days a week. and really extending their life. So, I just encourage you to any exposure that you can get to transplant surgery, whether it be in residency or as a medical student, and really speaking with the transplant surgeons about their passion for transplantations is where you're really gonna, hopefully, it's gonna pique your interest.
You all touched on it just a little bit, but can we talk about what it was that drew you to transplant?
I can take that one first. I myself first became interested in transplant when I was a medical student. And, I remember being a student and there was all this talk among the other students about how to place your clinical rotations to set you up for success to be a surgeon if that's what you wanted to do. And I remember being devastated because my surgical rotation actually fell in the last block and I thought I was going to be at such a disadvantage compared to everyone else. And I ended up doing internal medicine immediately before doing surgery. And I really loved internal medicine. I loved thinking about patients' complex problems and coming up with a diagnosis and thinking through a plan for them and really following that through. And for me, it was sort of a moment of panic where I thought, wait a minute, maybe I don't want to be a surgeon. And I was so fortunate because I then went to my what I perceived as a late disadvantaged first surgical rotation, and it was transplant surgery. And it was this epiphany that there is a surgical specialty where you really get to be a doctor that thinks about complex problems, and it is wonderful, beautiful technical surgery, but there is also so many other elements and facets to it that are interesting and just as important as what you do in the operating room. And so for me, I really never looked back from that moment. It was just this perfect mix of all the things I wanted in terms of a career. And now as I am a transplant surgeon and I practice, I think the thing that really keeps me excited is the relationship we get to build with our patients. And I think that, the others would probably agree with me that we are so involved in their care, before the transplant, through the transplant, and then beyond, because it really takes that kind of commitment from the team, and it's the kind of commitment we expect from our patients. And working on that together is really unique, and it's that to me is what makes transplants so special.
Yeah, I think the thing that really sort of got me interested in it, like was mentioned in the previous panel, sometimes the serendipitous finding of a good mentor, or a good experience. And so I had a great experience rotating with that service. My intern year of my residency was not something I had anticipated falling in love with, but had a great experience, and that led me to explore it further and really, like Dr. Sayed said, we all have our experiences. The first time you see one of these patients do well afterwards, what a big difference it makes. But I think it's the science of it is fascinating. All of the immunology and biology that underpins our ability to do this. And it is also probably one of the most multidisciplinary areas of surgery. From day in, day out, you're working with a whole host of other physicians, nephrologists, hepatologists, ID, urology, really everybody. And it's every day you're interacting with those folks. And so it leads to a really strong team approach, which can be very rewarding.
Yeah, I think I can echo what has been said. If for any of you that are listening to us feel, undecipherable about what career to choose in medicine, and you go to every rotation, and every rotation you like, and there is no way that you can make up your mind, and you love the precision of surgery and putting two vessels together, and you love, and you don't have to fight with anybody, about OR time, because the OR time will be open for you in the middle of the night. Nobody will fight for you except for probably trauma surgeons. If you want to actually follow your patients longitudinally, even have the possibility to transplant many family members that have congenital diseases, and become part of their family. This is the field to go. If you feel passion about discovery, because the truth is that we never stop learning. There is always something new. It is such an amazing field. It's probably one of the youngest specialties in general surgery, but yet a specialty that have progressed and evolved in such a short period so quickly, and is still mesmerized, about things that are being discovered on a monthly basis, right? That we thought that were dogmas, and all of a sudden those dogmas are being taken down. Perfect example is xenotransplantation and the frontiers that opens, to new faculties, how to do ex vivo rejuvenation or therapy of organs, how to tap into donor management and intervention, which is something that have not been really explored in the field. So there's a lot of areas of innovation that anyone who wants to make a mark and propose to actually be an innovator have a room and a place in transplantation. So incredibly exciting field.
Dr. Syed, do you have anything to add to that?
No, I mean, it's all been said, but it is incredibly multifaceted. It is incredibly collegial, and I also, as part of my academic work, we sort of, as well as working with the fellowship, I also work in the surgical skills lab, which is educating the next generation of surgeons how to do technical surgery. And when you're talking about technical abdominal surgery, it feels like the skill set that you come out with and the amount of growth that I personally felt throughout my transplant fellowship is incredible. And the things that I find myself being able to do now, having gone through that training, though it was hard work, is extremely rewarding, and the array of skills that you come out with is really helpful to a lot of people with a lot of different problems. And looking at it from a purely technical perspective, it is really rewarding. Personally, and watching the patients recover is extremely rewarding as well.
So you mentioned there a little bit about your skill set and the broad amount of skill set that you have to do transplant. Can you all talk about maybe some of the things that you do that aren't necessarily transplant, whether that be hernia repair or hepatobiliary surgery or what it might be?
I can start with that as well. But I think it's important to speak about transplant as well, where we do kidney transplants, liver transplantation, and pancreas transplantation, and that involves a recipient operation and a donor operation. So removing the organs from either a living person or a deceased individual. So the deceased operation, we do multi-organ recovery. So we recover the liver, kidneys, and pancreas at times. But from live donors, we also get to do laparoscopy or robotics by removing the kidney of a healthy donor and then using that kidney in another unhealthy end-stage kidney disease recipient. So that is also important to understand, is that we are able to use those minimally invasive techniques to be able to do some of the surgeries. And then on the liver side, doing hepatobiliary, which is removal of tumors from either the liver or the pancreas, and reconstructing some of these major blood vessels, such as the portal vein and the vena cava, is pretty high intensity and high risk surgeries, but can be done extremely safely if you know how to, if you've got that skill set that I was speaking about. In addition to that, operating on people with end-stage liver and kidney disease, whether it be dialysis access or hernia repairs or management of ascites, is also, sometimes even harder than doing a transplant, because they are so unwell, and it's the medical management and understanding of the abnormal physiology in those patients that really is the more important aspect than the technical aspects of that type of surgery. But it's really fun.
I'd just add to that, as you go through transplant fellowship, there are sort of different fellowships too that can suit your interests. So not every fellowship is exactly the same in the breakdown of kidney, pancreas, liver transplant that you'll be exposed to. And some fellowship programs will do more of one organ. You can do a fellowship in just kidney, or you can do a fellowship that's more heavily focused on liver. And each fellowship has a unique mix of general surgery operations that they may be doing, or HPB, hepatopancreaticobiliary operations that they may be doing. And so if that suits your interest, you can sort of tailor the training that you get in transplant to fit what you're interested in. And I think the field of robotics transplant is one that is really growing over the last few years, and I think it'll continue to grow, as we're seeing in many surgical specialties. And there are fellowship programs that do a ton of robotic volume if you find that is something that you're really passionate about. And so you can be sort of clever and smart about choosing a fellowship program that matches the unique practice paradigm that you want to have when you eventually finish your training.
So everybody's kind of mentioned liver and kidney. There's pancreas, small bowel transplant, heart, lung. How does that mix come about? Should you do a different fellowship to do heart and lung transplant?
Yes. Oh, go ahead, Dr. Sayed.
No, please go ahead.
So heart and lung transplant is done by cardiothoracic surgeons, and so if that's your area of interest, then you'd need to look at a cardiothoracic, either fellowship after general surgery or an integrated program, but somewhere on that pathway. And certainly there are individuals who that's become their career, and that's really the focus of their work is thoracic transplantation. When we talk about transplant surgery fellowships, though, we're really talking about abdominal transplant. So predominantly kidney and liver, pancreas. Small bowel is out there. There are several programs that do small bowel transplants. The volumes are not particularly high, and so if that's an area of interest, you really have to kind of seek that out in particular. It's not something that most training programs will have a big exposure to. Pediatric transplants, sort of similar. There are a handful of high volume centers. A lot of centers do a little bit, but if that's really your passion, you'll want to seek out one of those centers that does a lot of it.
What about location? So Do you need to be in a big city to do transplant surgery? Can you do it as a rural options? What about global health? Like mission type surgery, those kinds of things. Are there opportunities available there?
Yeah, I think that what Doug mentioned. I think it's right. You have to actually say what kind of a specialty or what level of expertise you want to acquire uh, during your fellowship, and that's going to tailor a little bit your specialty, and it's going to tailor a little bit opportunities that will be open for you in terms of seeking jobs. In terms of um, going to a rural program to train versus a, uh, a more city-oriented program, I would say that all depends on what you're searching for, and all depends on whether the program that you are exploring, whether it's in a city or in rural area, has the training that you're seeking for, and that you will be happy at the end. There is uh, happens to be that the vast majority of the large transplant programs tend to concentrate on large cities, but we have a perfect example, UAV, right, that is in uh, Birmingham, Alabama, and that's a moderate-sized city. Places like Madison, Wisconsin, for instance, is a perfect example of a small city with a rural environment nearby, probably 10, 15 minutes away. And yet you have an extraordinary volume of cases. So I wouldn't actually concentrate on going to large cities versus small cities. What I would search is probably if that program offers what you're looking for, and you identify with the people that are going to be training you, and those good role models for you for your future career.
Yeah, I
All
think
right, well, we've got, oh, go ahead. Sorry, go ahead.
it's worth mentioning though that for a variety of reasons, having a transplant program is a huge investment from the hospital system, and so because of that, really, when you look for programs, you're going to be looking for existing programs. This is not something that you can go someplace and just set up your own practice to do this on your own. It really requires a lot of buy-in from the hospital and support from the whole system. And so it's a little bit different than some other areas where there's more opportunity to go into private practice or independent private practice, I should say.
Just to expand on that a little too, as a young surgeon, transplant is sort of nice because of that fact, you almost have a practice already built in, and you have a wait list that those are the patients you're going to operate on. And some other surgical specialties, you sort of have to build a practice and build referral patterns. And for the most part, when you're a transplant surgeon, that already exists for you in many jobs that you would take. And so that is a definite benefit.
I'll dovetail. Again, the majority of transplant programs have a good-sized surgical team. And again, as a younger surgeon, as you're trying to increase the complexity of cases that you're doing and the difficulty of cases that you're taking on, having a great team around you of people who mentor you and help you, in your junior years of training is incredibly important. And transplant is really a team sport, and it's really enjoyable to spend time with my colleagues at work and learn from them, years after I finish my training.